For ages we know that pregnancy per se is not a disease. It is a physiology. Every woman is destined to become a mother someday or the other. But in recent times, pregnancy in certain conditions have reached a high risk status. Why? Late marriage, associated complications. Many of the pregnancies are due to IVFs, and these pregnancies need some special care. As the age of the mother increases, incidence of diabetes increases, incidence of hypertension in pregnancy increases, there is an increase in other medical disorders. So these subset of pregnant patients fall into a high risk status, and these patients need a care in an institution which has got a coverage both for a mother, with an intensive care unit coverage for the mother and an extensive coverage for the baby, for the newborn. You need a level 3 care. So these patients, for every pregnancy is precious, but these patients who may have the last chance to conceive, this may be a last chance to conceive. She's already around 40. She's got an associated medical disorder. They always look out for an institution where both the mother and the baby would be safe, and the baby would tide over any crisis that may come across the way. And I feel that this institution is one of the best in Calcutta. Now, what exactly is high-risk pregnancy? High-risk pregnancy, the commonest high-risk factor now in our days, as we all know, India is the diabetic capital of the world. Day by day, we are seeing increasing number of young girls with diabetes needing insulin therapy during pregnancy. And these patients, the babies of these patients are prone to develop hypoglycemia, hypocalcemia, and as such, they need an extensive coverage at least for the first 72 hours after birth. Next, the other high-risk factors is hypertension, pregnancy-induced hypertension, where the BP shoots up very high. The mother may end up having fits, eclampsia. Here, you need an intensive care for the mother itself, so that either prior to delivery or post-delivery, she does not go into a convulsive state. And these patients who are treated with antihypertensive or medications to prevent convulsions always have a baby who is a high risk. These babies, at least for the first 48 hours after birth, require special coverage. So you should always have a setup where both the mother and the baby is very well taken care of. Next, we were talking about IVF pregnancies. IVF pregnancies, as we all know, most of them are in elderly pregnancies, and sadly we are making mothers out of grandmothers. So the physiology is changed. It's when a patient gets pregnant at 45, it is not a physiological pregnancy, it's a pathological pregnancy from day one. And these are the patients who are high risk from day one of pregnancy. They require special care for the mother and special care for the baby, because most of the time we tend to bring out the babies in a premature state. Maybe at around 32, 34, we are forced to bring the baby out so that the baby is better off outside the mother's womb than staying inside the mother's womb. So these patients, be it the mother or the baby, require an extensive coverage both during and after delivery.